Hi everyone, welcome to week 10 of your Pharmacy Procedures 2 course. This is the final week of the course, so just a few reminders. You actually do not have a discussion post this week. You don't have an assignment this week. The only thing you have to do this week is to complete your final exam. So just so you know, your final exam is over everything that we've covered since the midterm. So I've kind of pulled those PowerPoints up so we can just kind of take a quick peek at them to kind of give you just some refreshers. But the key thing to remember is you must get everything done by Thursday because grades are due then and you have to have everything completed or you'll end up with a 0. So you've got to get everything completed this week by Thursday. So this week, the final exam will cover everything since the midterm, which includes things about the IV flow rates, so where we talked about both the electronic infusion devices and the manual devices using drip rates. The other chapters that we covered chapter 19, which is where we looked at actual infusion times, so the time needed to complete using either an electronic or a drip rate set, or a manual set, I should say. We talked about IV medications and titrations, so where we would have a range of medication dosages we could use in an IV. That's what was covered in chapter 20. Chapter 21 was all about heparin. So if you remember, heparin is our anticoagulant drug. So we want to make sure that we're calculating our heparin doses accurately, because if we've got too much heparin in the bloodstream, blood's not going to clot properly. Patient could bleed out, all kinds of things like that. So that was the next chapter that we covered. Then we covered chapter 22 and 23. Chapters 22 and 23 were both pediatric chapters, so this is the chapters that we covered dealing with pediatric medications. So parenterals are anything that's not oral, so the things that are oral and the things that go through IVs typically is what we mainly looked at, but also we could be talking about intramuscular or subcutaneously for parenterals as well. So pediatrics, it arguably is one of the more important categories that we covered in the last half of this course, because of course our pediatric patients are much smaller than our adult patients. They've got a lot of special characteristics that we have to keep in mind. Things like, their bodies obviously are smaller, but they're also not as developed. So that's something important to keep in mind when we're calculating their doses. So make sure that you go back and you review everything from these previous weeks. If you missed anything on the assignments in weeks 6, 7, 8, or 9, go back and look them up and make sure that you know how to do them correctly now. If you don't, if you still have something that you don't understand, something you might still have a question about, anything like that, please reach out to me. I'm happy to go over any of those topics with you before you take the final exam. Remember, it's really important that you have those topics nailed down before the final. The final exam, again, has to be completed by Thursday. If you have any questions, please make sure you reach out to me before you take that exam, and make sure you have everything completed by Thursday. Now, if there's anything at all that you're missing from the previous weeks, and that could be anything from week 1 all the way through 9, if you're missing anything at all, and you still want to turn that in, I will still take it and give you credit for it. So let's do what we can to get your grade as high as possible by going back and looking for anything that's missing. So anything that might have a 0 in it is something that you can still complete and turn in. The only exception to that is discussions, because obviously there's no one in the discussion to discuss with anymore. So you can complete any assignment or any quiz that is still out there that has a grade of 0. So again, let me know if there's anything at all that I can help you with. You can reach out to me by email, text, or call. And it has been a pleasure having you in this course, and I hope you have a great week.